Welcome to Suzette's Guilty Pleasures. I'm your host, Suzette. Today, we are going to be talking about fibroids, something that I feel that a lot of us women go through. And I have a special guest with me that's going to take us down this journey. A brief bio about my guest. Her name is Janelle King. She's a registered nurse, writer, and blogger. She holds a bachelor's degree in nursing and a master's degree in public health. She has written articles for Sisters from AARP, The Body, the HIV/AIDS Resource, blogs, among many others. She has been featured on the Femme Focus podcast, Be Well Sis, and the You and I podcast. In her spare time, you can find her writing about reproductive health and wellness on her blog, thenursenote.com. You can also find her on social media for Facebook, Instagram, Twitter, and Clubhouse, which is now becoming very popular, at the Nurse Note. Thank you so much, Janelle, for joining me today on this beautiful Sunday.
Thank you for having me. I'm so excited. So excited to be on the podcast and also to reconnect with you because it's been a long, long
A
time.
long time, high school.
Right.
So that's a long time, right? Yeah, so I follow you on Instagram. How I decided to ask you to be part of it, but I follow you on Instagram, and you being a nurse, I understand you are in the States, but I do feel that a lot of the information that you have out there in the States, it is sort of relevant to even us here in Canada, right? And I mean, when you look at a lot of research, you don't find that much Canadian research when it comes to women's health, especially Black women's health, right? Versus I feel that if you find it in for the States, it's more readily available.
Mm-hmm.
So so let's talk about fibroids. I think this is one of the biggest topics that it just seems to be getting bigger and bigger each year, I find. What do you think? Like, what's your perspective?
Totally. That's absolutely right. Like in the past, I would say couple months, it's just been like a hot button topic. And I don't know why that is. I don't know if it's because like we're just bringing more awareness to the topic. So, it seems like everybody's talking about it, but yeah, it's kind of a big deal. And maybe because at least here in the States, like there's more focus on, women's health, especially for African Americans. And so, African Americans tend to get fibroids more often, or it's more common in African American, or I should say Black women, let's put it that way. So because there's more focus on women's health, especially in the Black community, this may be one of the reasons why fibroids is one of the topics that have surfaced as like a hot topic for
Right.
now and this year.
And it's true, because it's funny, I don't remember hearing about fibroids as much growing up.
Right.
And realizing that I want to say within the last few months, it's like almost everyone that I've spoken to has either had fibroids, is going through right now, or like it's just like, why is everybody having fibroids? Like, where's it coming from? How is it starting? Like, it just seems so much more confusing. But I think, I don't know, is it because everyone's in their home and COVID is around? So maybe people are now starting to, notice, like, I don't know. It's weird. Weird.
It is. It's I think it's always been like around. And another reason why could be because so especially because we're in like an Instagram and social media type generation, like we are shedding a light more on women's health and like these subjects. So now it's like okay to discuss these. Whereas before, like growing up, I didn't really know anybody who had fibroids, or we didn't talk about it. So, just the fact that women are now more comfortable discussing their reproductive and sexual health issues that could be another reason why it's now like a topic and something to talk about.
And that would actually make sense, because you're right. Growing up, especially within the Black community, depending on your culture, parents didn't usually talk to us about certain things. So
right.
I think you're right about that. I think
right.
So I know that a lot of people know fibroids as fibroids. Is there another name that people may be like, they may not be sure if it's the same thing, or?
Yeah. So the other, like, I guess, like the scientific or the medical name is myoma, is the other name that you might hear physicians use for fibroids. It's more common, and people know it as fibroids, but it's also known as myoma. And basically what fibroids are, it's a cancerous growth, but I should say, excuse me, it's a non-cancerous growth
Okay.
that happens usually in the wall of the uterus. And so it's most common during childbearing years. And there's a lot of science and research behind it, but they think it may be related to like hormones. And that's why you see women during their childbearing years have are more apt to having fibroids, I should say.
Okay. Okay. So I know that they usually say, I actually did get a statistic for Canada, and I know that they were saying that they're very common in women over 30.
Mm-hmm.
But I'm finding that even some women, it's like they're starting already to have it even under 30, right?
Yeah.
Now. So, and I know you said that it usually starts within the reproductive stage, but isn't that a little bit early, or is it? I don't know.
No. So the way that they develop, it's usually based on hormones. So like once you go through puberty and you have these like reproductive hormones like your progesterone and your estrogens, you can develop fibroids. Now the thing about it is like kids or young adults, young women may have it at an earlier age, but they may not have any symptoms, so they may not recognize that they actually have fibroids. But yeah, it's like it's common here too. In the United States, like they say, the women's in their 30s usually are the ones who have fibroids.
Right. Okay. And is there something that, other than the fact that when we have our periods and things like that, but is there something else that might exacerbate the hormones from maybe getting bigger?
Yeah, so there's a lot of science behind it. But no one knows for sure. So some of the things I think they talk about, or what I've read, is like they say red meats may exacerbate it. They say that being overweight you may be two to three times more likely to have fibroids. They say that having your period at a younger age may be one of the reasons you have fibroids. Yeah, so there's a lot of science and research, but nobody knows for sure why they develop.
Right. Okay. All right. So the other question that I had so it's not seen as genetics. I think sometimes some people or some women may feel that, oh, it might be a genetic thing, right? You just mentioned that sometimes red meat, depending on what you eat, can cause it.
Mm-hmm.
Has there been any kind of scientific thing to say like there might be a genetic piece to it?
So there's more recent, yeah. So in recent years, there's more research into genetics, and they say like the thing about fibroids is nobody knows what causes it for sure. So they're saying possibly there could be a genetic component to it, but they've looked at, there's like a lot of different theories that are being researched right now, but there isn't like one theory to say yes, this is the reason why
Right.
fibroids develop.
Okay. And I know that there's quite a few treatments for it. So just to tell my story, so
Mm-hmm.
I actually suffered from fibroids back in 2015. And I guess this is a question that I actually have for you.
Mm-hmm.
What's the difference what's an ablation?
So an ablation is, so you have your uterus, and hopefully everyone knows where that's located. So with an ablation, what happens, they'll go in and they will essentially like burn your uterine lining. So what that does is if you have like heavy bleeding, it will alleviate that symptom. It won't necessarily get rid of the fibroids, but you're more likely to have less bleeding with that.
Right. Right.
The issue with ablation is like if you're in your reproductive years and you want more kids or you haven't had any children, doing that may reduce your fertility. It may hinder your fertility, to say.
Okay. Okay. So just to make it clear for our listeners,
Mm-hmm.
so an ablation does not necessarily mean it will rid of fibroids. Like you do have the possibility of getting it back.
Right. So the fibroids may still be there. But it helps to eliminate the symptom, which for most women or a lot of women could be like the heavy bleeding.
Right. Okay. So so on my journey, in 2015, I had an ablation
Mm-hmm.
completed. And just as you said, like it does make your periods a little bit less and stuff. And it was great. I was like, oh, this is amazing, like, oh, because I've always suffered with long periods and then
Yeah.
they were heavy, right? So I was just
Yeah.
like, this is so great.
Holy Grail.
Right? It was. And then I started to notice that it was starting to the periods were getting heavier again. And it was starting to get longer again. And I was just like, what's happening? So last year, and I was getting cramps, but it wasn't severe like it used to be before. But they were coming back again. And so in the summer of last year, my daughter has a friend who has a daughter, and she was over, and I was wearing this dress. We thinking that we look good,
cute and fly,
right? I was feeling nice that day, okay? And this little girl came to me and said, and God bless children, God bless what they say. But she came to me, she's like, Susie, you look like you're pregnant. I was like, what? I'm like, oh no. But somebody come and snatch this child before I do. Like, it was one of those moments. And when he said that, I was like, oh my gosh. So I said, let me go to the doctor and just get an ultrasound done. And I went, they found 10 fibroids, and
wow.
I forgot how big they said it was, but I was just like, this needs to come out.
You're done.
Yeah. From a child is telling me that I look pregnant, and at my age, I was like, no, sorry, no. So, I mean, I did recently get, I know when I went to see the doctor, he did give me different options, right? And
right.
I mean, some of the options I know he said, well, you have 5 more years till menopause. Just wait it out and let it shrink. I was like,
yeah. What? Yeah.
5 years is a long time. You know what I mean?
Yeah.
No. And then the other option he gave me was something about a pill that I would take, but it would affect my liver or something like that.
It's probably the Lupron. So yeah, if it is the same one that I'm thinking of, like they can give you a pill, it will help to shrink the fibroids, but you can't be on the pill for like an extended period of time. Is that
right?
Yeah.
It's like it's like 3 months here,
right?
And then off in 3 months. And I was just like, no, because it's like you have to get tested. Your liver has to be tested.
Yeah.
And I was just like, no. So when I told him, like, just do the surgery, let's just do it. He was like, no. And I was like, I'm good. And he's like, I'm not planning to have any more kids. Like, I'm in my 40s. I'm done.
You're done.
I'm done. But it was like, he was really hesitant on wanting to do it. And he was like, think about it and come back. I'm like, there's nothing to think about. Like, this is what it is. So anyways, I did end up having it. However, so I did do a hysterectomy.
Yeah.
He left my ovary so that I would start menopause early.
Yes. Yeah.
Right. So I guess the question I have, and I was when he told me that, I was just like, but isn't listen, I was bad at science, okay? So I'm going to put it out there. I feel science.
No judgment. There is no judgment here, Susie.
But I got to ask, so isn't our ovaries in our uterus?
No. So your uterus is the womb. So that's where you carry your baby. So it may be like, it looks kind of like a triangle, let's say. So your ovaries are, so from there, your 2 fallopian tubes. Most women who have uteruses have 2 fallopian tubes. And then on the end of those are your ovaries.
Oh,
yes. So, yeah. And most times when you do have a hysterectomy, they will leave your ovaries in so that it doesn't put you into premature menopause and then create a whole other set of issues for you. So that's very interesting that he was hesitant to actually do the hysterectomy. Did he say what his reservations were?
He just felt that it was more of a better option. Like for him, it was, if it's not broken, why fix it? Right. Because he even asked me, like, are your pains really bad? Or, like, is it actually, like, when you have your period, it's so unbearable. And I was just like, not really. So I think that was also the other reason. But for me, it was about no. And that little girl, she traumatized me with that comment. I was like, I cannot be walking around making people think I'm pregnant. Definitely not. Okay. So yeah,
That's hilarious. Yeah, that makes sense because, as, providers and physicians, they'll probably want to do the least invasive treatment, which for you would be like the Luprons, or I don't know if the birth control is an option, or IUDs and that kind of stuff. And then he like, because you are approaching menopause, yeah, I see why he'd be like, well, why don't we just wait it out if it's not that unbearable?
so I have a question for you then. So what are pros and cons? Like I'm sure it's sort of obvious, but like what are the pros and cons to a hysterectomy though? Like
So the hysterectomy, which is like removing your uterus, it gets rid of the source of the problem. So because the fibroids are in your uterus, you're removing, where fibroids grow.
right.
And so the pro is that you should no longer have the heavy, the cramps and the heavy bleeding and everything that comes with fibroids. The downfall, and especially for women of younger childbearing age, like once you take your uterus out, I mean,
They're done.
you're done. Like you cannot have children, right? So
Okay.
that's where the decision comes in. Okay, like what else can I do? Because I still I know I have friends who are younger and they still want to have children and they haven't had children yet. So it's like, what else can I do? And so some of them will opt for a myomectomy, which is it's usually it's a surgery. So they either do it laparoscopically or they go vaginally, or they open you up and they go in, and depending on the locations and the size of your fibroids, they can go in and remove them, take your fibroids out. So that may provide some relief, but that's not to say that your fibroids won't grow back.
Okay.
Right. So hysterectomy is the other thing we talked about. And then we talked a little bit about medication. So that's the other thing. Medication, in terms of sometimes people are offered with birth control, and that doesn't get rid of your fibroids, but it will help with the symptoms. So usually like the bleeding and the cramping. So it's either birth control pills or like an IUD. Those are usually some of the ones that are offered. And then we
So
talked
sorry,
about,
not to cut you off, but if
uh-huh.
the fibroids are sort of exacerbated by hormones, doesn't the birth control, because the birth control deals with our hormones, right?
Yeah,
Doesn't that,
it's so most often they would give it, I think, if I'm not mistaken, it's like estrogen dominant. So if you're
okay.
given a hormone, so they would probably give you progesterone
Mm,
to kind of balance everything out.
okay.
So like an IUD with progesterone would help with symptoms and help to control the bleeding and the cramps and that kind of stuff.
Okay.
So those, and then we talked about like the medication, the oral medications that you can take. The Lupron, I think, is what you were advised or encouraged to take.
Okay.
And so it's good because it helps and it shrinks, but you mentioned the downfalls. So like having to have your liver checked, and then it comes with, I think there's it's a higher risk of depression and it disturbs your sleep. And so there's those things to think about as well.
Right. Right. And it's funny because when before I was going to get my surgery, a lot of people were asking, are you scared? Are you nervous? I was like, no, I'm
Mhm.
good. Like I'm fine, I'm fine. And but it was like afterwards, it was just like, so certain people didn't know what kind of surgery I had.
Yeah.
And it was like, they're asking, I was just like, don't worry about it. And it was like, I felt bad. I started to feel like embarrassed because sometimes I've heard stories of some women that feel like when they have a
Mm.
hysterectomy, they don't feel like they're a woman
Woman.
anymore.
Yeah.
You know what I
Yeah.
mean?
Yeah.
And as much as I feel like I know I'm still a woman, but I didn't take into account or even think the emotional aspect, like the mental
That's true.
aspect that it would
Yeah.
on me afterwards.
Yeah.
And I don't know, is that obviously related to like maybe the hormones? You know how these hormones and
I
uh,
think it could be. I mean, I think it's having it, and I understand, like, it's a major decision, like a major decision. And yes, you think about it from a physical standpoint, like, how am I going to get better? And how long is the recovery going to be? And is it going to stop my bleeding? Am I going to be better and
right,
sexy and ready to go? But
right.
yeah, the whole reproductive system is tied to femininity and being, in essence, what it is to be a woman for some women. So you're absolutely right in your feelings in terms of like, I mean, I'm sure you still feel like a woman, but like when you step back from the situation, you just think about it, you're like, well,
Yeah.
this is like a huge big deal, and although I didn't want any more kids, now I know I cannot have any more kids because
Right.
I don't have a womb. So yeah, your feelings are very valid and it's not uncommon.
Right. And I have a question for you because I don't know how it is, but with hysterectomy, and I don't know if you would know, but I know that I read in research that, it affects the sexual piece of it. And I was just like, oh man, how does that affect?
I mean, there's a lot of factors to come into play. Like it could be just the part that you talked about discussing, like just the part of an essence of your femininity. It could be hormonal and what's going on down there. So yeah, there's a nothing's ever simple. Like you think it's science, but it's never just science. There's like, we're humans, so there's the human aspect to everything. So
Right, right. Somebody had mentioned about the pelvic, working on my pelvic.
like your pelvic floor
Yeah.
muscles.
So what is that like? So what does that do versus like, so with me now taking out my uterus, how does that affect my pelvic, I guess, floor or?
That's a good question. I'm trying to think of why they would say that. So I guess it would be related to, so your pelvic floor, it's like a sling of muscles that kind of keep all your stuff where it's supposed to be,
Okay.
right? So I guess, and I can't speak for the person. I don't know if they were thinking in terms of like your pelvic floor would become weakened because of
Mhm.
that.
Okay.
So and I was like, I wish I had done this myself personally, like using a physical therapist who specializes in women's health to strengthen those muscles so they don't
Wow.
weaken, essentially. Yeah.
Okay.
I wish that I had known that after I had given birth. I'm like, oh, my life, this was so handy. This would have been great. But yeah, like now I know a couple here in Atlanta and I'm like, dude, like, I don't know why we didn't know about you, but you would have been so helpful after giving birth. So yeah, I always tell women like, hey, this is an option for you, not only for after giving birth or things like that, but like just like sexual discomfort, pain, that kind of stuff. I always recommend a PT who specializes in women health.
Okay. All right. Yeah. Yeah. And I think that might be why she had it was actually a friend that was recommending it to me, mentioning it to me. And I've never actually heard about it before. So I
Yeah.
was just like, that's interesting. So now that you've explained that, maybe it's to help the muscles, that would
Yeah.
sort of make sense, right? Because
Yeah.
I mean, they did cut and all of that stuff. So
Yeah. Yeah. We don't want those muscles to weaken. So, um, find you a good pelvic floor. Well, pelvic floor specialist or a physical therapist is usually, at least here in the States, it's usually a physical therapist who specializes in women's health, who do pelvic floor activities. So yeah,
Mhm.
find you one and make sure everything is tight and where it needs to be.
No point. Trust me, I hear you. So okay, so I mean, I don't know if there's anything else to really more talk about fibroids. I think you've pretty
Mhm.
much summed it up in the sense of when it comes to treatment, it sort of depends on what stage you are in your life, whether you've had kids or not, or you're done or you're later on in life, the treatments would vary, right?
Yes. So, I guess people often ask, like, what is the best treatment, is how
Right,
they usually phrase it. And I'm like, well, the
right,
best treatment for me may not be the same for you, right? So you got to figure out the treatment that's going to work for best for you at whatever stage of life you're at. So for you, it was getting a hysterectomy because, you've got grown kids and you're
right.
done, right?
Yeah,
So, but for somebody who's like 31 and who hasn't had any children yet, that may not be the best treatment for them. So working with their provider, and I always say, like, find you a good healthcare provider who's going to sit down with you and talk about the different options. And if you don't feel that this provider is listening, or they're trying to steer you in another direction, it is okay to find somebody else who you can have a real relationship with. Because at the end of the day, it's your body, it's your health, and you want to do what's best for you.
for sure, for sure, for sure. Okay. So I'm following, as I stated before, I follow you on Instagram, and I know that you've been talking a lot about menstrual products. And
Hmm.
I know actually within the last few years, they've been really talking about staying away from like maxi pads because I guess the whatever is in it does affect us and toxic and things like that. And now
Hmm.
all of a sudden we have these things called cups. When I first heard about it, I was just like, ew,
Me
that's gross.
too. Me too.
And I was just like, blood in a cup. Like, I I need you to explain, first of all, what okay, so I know that the pads and what it is or whatever, but like you compare the pads to now these cups. What is the pros and cons, and why should we start using cups?
So here's the thing. I'm kind of like my brother calls me like a tree hugging, environmentally friendly greenie, right? So like for you, like I was like you at one point, like I'm not good. Why would I do this? It's like gross and weird. And so I decided to try it. And I use cups. I don't really use like tampons or anything else. Like I mostly use cups and discs. And I like it. Like once you figure out how to use it, I love it. I like it because, you know, for me, I work long hours as a nurse. So
Right.
if I'm inserting it correctly, you can use it up to 12 hours, although, you know,
Wow.
yeah. So you can use it up for 12 hours. It saves you money because, you know, your one cup lasts depending on how you use it, but it can last for like years.
Oh, wow.
Yeah, and it's reusable. Now, you know, there's always downfalls to any product you
For sure.
use, you know, and the science is still not 100% sure, but like there's still a risk for toxic shock syndrome, which is like a bad infection that you can get like with tampons or anything you're inserting into your body. So the recommendation is to have more than one cup and, you know, making sure you change it out and boiling and that kind of stuff. So for those reasons, I like using cups. I've never been a pad girl. I just felt it was like real like squishy. I felt like I was wearing a diaper. So for me, it wasn't for me.
Right.
But I always tell women like whatever you are comfortable with, like whatever you love, it is okay to continue using that. Like if you love your pads and you just a pad girl, okay, just continue to use your pads. Like,
Right.
but I just feel for me, I like my cup because, you know, I can use it forever. I don't have to be in the store every month buying products.
Yes.
It lasts for 8 hours. And once you get over the ick factor, because it was kind of like, it's like blood. You're like, oh,
Yeah.
But once you get over the ick factor, like it's one of the best, like I love them. So.
So, well, okay, so you have to so you have to break it down. Like, I don't know if you have a cup near you, but you need to break it down for me because I really need to like I was always wondering, like, first of all, how do you put that up there? Like, how does it sit? And do you have to, when you're using the washroom, like, how does that work? And then it was funny, I was talking to one of my friends and she said that she tried it. And
Mhm.
one thing that she didn't like about it was when I guess when she was in public places,
Mhm.
I guess
Empty
it
it.
was like gross. And I was like, first of all, I would not do that because like, oh my God. But other than that, so for me, it was just like, what is this? Like, I don't get the cup.
Okay. So it looks like I guess an upside down bell. Do I have one? Hang on one second.
Okay.
And so there's different folds that you can use. So
Right.
this is like my demo cup. So
Right.
you
Okay.
figure out there's like usually two folds you can use. One is like I think they call this like the U fold where you fold it like this. And
Oh,
there's another one.
okay.
There's like a push down fold. So it looks like a flower.
Okay.
So once you do that, you like push it all up into your vagina and
Right.
it sits close to the your cervix. And
Okay.
so this is your vaginal canal. Let's pretend this is your
Right.
and it sits there. So everything that's coming out of your uterus and cervix, it just drops into the cup like that. And
But then
so
it's draining. No?
no, because it's like it's suction. So it works by like suction. So if you're inserting it correctly, it's sealed and sticking in there. So nothing should be
Okay.
coming out. So this is how it's
Okay.
right. So this is how it should sit for hours and hours and hours and hours.
Right.
And so once you are ready to take it out to like empty it, you kind of have to break the suction. So you like kind of push in and then you kind of slide it down. So and make sure not to like tilt it so your blood falls out. And
Right.
then you tilt it and then you just empty it. You empty
Okay.
it, you rinse it. There's like they have fancy washes for them. They have like cloths for them now. And then you just kind of do the same thing. This is the fold that I use. So I think that I don't know, it's like a flower or something.
Okay.
And you insert it back in and you keep going.
Oh, okay then.
Yes, yes.
Okay.
It is a little hard. Like your friend is right. Like it is a little harder when you're out in public because like if you don't have a single stalled,
Yeah.
washroom with a sink, you're like, okay, what do I do? Like you can wipe it off with toilet paper, I guess. But the beauty about it is that like you don't necessarily have to empty it while you're out, because if depending on flow, of course, like
Yeah.
you can go for hours without having to empty it.
So talking about that, so is that product good for even for those who have a heavy flow?
It can be. So like with any menstrual product, you have to find the product that works best for you. So some women have found like they come in different sizes.
Okay.
So like people who have had kids before, they figure like your uterus is a little bit more open. So, use this size cup, and then you may have to empty it a little bit more frequently if
Okay.
your flow is heavy. And then I always like, especially if it's a new product for you, I tend to tell people like there are things called period panties.
Yes. You know what though? Does it really work?
It
I don't.
does.
Oh, it does?
It does. Yes, it does.
Okay. So do you know what it is? Like you've used
Yes, I let me show.
because
So
I've
they do.
always
So
wondered doesn't it feel like it's always wet down there? Like
so it depends on the brand, of course, and it depends on the absorbency, but like
yeah.
period panties, this is what it is.
Okay.
And so like I will sometimes use my cup in my period panties and I don't get any leaks. Like, and then like for days where, my period is like at the beginning of my period, at the end of my period, and I don't feel like wearing anything, I just
Right.
wear these. And then
Right.
it just absorbs. There's nothing. And then you rinse and good to go.
Okay. I've always wondered about it because I had the conversation with my daughter and I was just like, that's gross, guy. Like, first of all, I understand it's like there's a thing like in the middle piece. I'm
Yes.
just like, where does where does the blood go? And doesn't it feel like you're wet and
It
like
it doesn't feel like you're wet, but there's a like, especially with this brand, like I wear Dear Kate brand. With this brand, there's an absorbent middle layer, and I guess that's where it sucks the blood
okay.
into that layer, kind of like a pad. Where the pad will
Yeah.
like, yeah, so something like that is where it sucks it into that section and it stays there, and you
Oh,
know you're good to go. And like they have different absorbencies. Like they have ones that are they say is only for like your light days, or comparison to like, I don't know, wearing one tampon. And then they have some that are like for heavier flow. So it
okay.
just depends on, what your flow looks like. But I always tell, I just wear them with like, I double it up with stuff. So I wear it with like my cup or my menstrual disc.
Right. Okay. Look at that, eh? When we were growing up, it was just about pads and tampons. That's it,
Right. That's
right?
it.
And now
Right.
it's like these options, and I'm just like, what the heck
What
is
is
all this nonsense? And now they
what
want
I
us to touch our blood and why?
what I do love about the period panty is like one of the doctors I used to work with, she was the first one. She went to some fancy conference and she was the first one that I heard about period panties. I like it for like girls that have just started their period, like as an introduction into like the whole menstruation and how to take care of yourself. So because
Right.
when you first starting your period, it's kind of all over the place and you
Yes,
never know when it's coming. So that's another option for them to have, so which I think is a little bit easier sometimes for younger girls than having to worry about a pad or
for
how to
sure.
even put a tampon in.
For
So
sure. It's
yeah.
already a shock that you're like, oh my gosh. For some kids who has never had parents who talk to them about their periods, and
Right.
all of a sudden you're bleeding. Like,
What's going on?
exactly.
What do
So
I
no,
do? Yeah.
that
Yeah.
makes sense. That's actually a good idea for those who are actually starting to wear that. That makes a lot of sense.
Yeah.
Okay.
Yeah.
There's something else that I've noticed that you talk about, Coochie Convo. First of all, can I just tell you, I love the title, Coochie Convos. I'm all about Coochie Convos. Let's talk about Coochie Convos. What is your Coochie Convos about?
So I'm gonna give kudos to my husband because he came up with the name, and I was just like, nobody's gonna like that. Like, women are gonna like that name. He's like, trust me, women are gonna like it. So he came up with the title. So Coochie Convos, it's just really about simple topics related to like menstrual and reproductive health. So like I guess because I talk about it all the time, like I get questions about all sorts of stuff in my DMs. I'm like, let's have a Coochie Convo about it. So like I'll get questions about like STI testing or like infections. Is this like, do I have an STI, or is this like bacterial vaginosis, or is this an infection? So I'll talk about things like that, or like menstruation and products, talk about things like that, or just about general hygiene, like, well, how do I keep this clean, or what am I supposed to do? What products am I supposed to use? And so I'll talk about that. So Coochie Convos to me, it's just an essence of what I do every day, like talk to people or talk to women or people with youth, like about things related to reproductive and sexual health.
Okay.
So I just make it more like conversation, because when I was growing up too, like, my mom's Jamaican, so we got this, she taught, but it was kind of like, this is what it is. It was kind of like a one-time thing. So
Exactly.
I'm trying to provide on my platform, I just provide information to women who need to know these things, because they may not have anybody to talk to about these things. So like, let's talk about it. And because we're in an era where we're sharing on social media and we're talking about all different things, like, why not talk about these things?
Yeah, no, and it's so true, because like, yes, when we were growing up, our parents would give us the basic. They would say what they say, and that's it. Don't ask no questions. Done.
You're absolutely right.
And I mean, I know when I had my, and then because of that, then when I had my daughters, I was nervous to talk about. I was like, I don't even know what to tell you. Like, how do I explain this to you? I remember I was in university, and one of my friends was like, have you had a conversation with your girls yet about period? I'm like, no. Definitely not. And she's like, no. And she brought me to the bookstore and was like, we're buying a book. You need to have this conversation. But it's just, so as we get older, and it's basically how we were raised, right? We don't talk about those things. Those are things that you learn at school.
Right.
But you're right. Like, now that we have the internet and we have, Instagram and all the social media, it's another way of being able to, do the research, and let's try to sit down and have this conversation. You know what I mean?
Right. Just providing, and like, just information that, to me, I guess my husband always tells me, like, it's not common knowledge. Like, to me, I'm like, this is common knowledge, but he's like, it's not everybody, it because, that's the area you work in, but not everybody knows it. Right. So I'm like, I guess you're right. So let me just present the information in kind of like a friendly, upbeat, simple tone, so that, everybody has access to this information.
Yeah.
So even my daughter,
and that's why, like, reading your posts, because it does come off like, the way you present it, it's very simple and understandable, and you don't feel judgmental to know that you're here. You are this big woman, and you don't even know this stuff. Like, what's wrong with you? So I don't feel bad. I don't feel judged.
Right. And that's kind of the thing. Like, and even in my clinics, like, people will come in, I'm like, this is just a judgment-free zone. I just need to know this information so I can know how to help you. So that's why I'm asking all these questions. So yeah, that's what Coochie Convos is about. It's just about having conversations about reproductive and sexual health. My mom laughs all the time. She's like, you still talking about this vagina stuff? And I'm like, yeah, still talking about and she'll send me articles about stuff. So, I really, like, I totally appreciate it. And I love the fact that people are comfortable. Like, I don't always know all these people. Like, they'll come to me and they'll ask me questions, or they'll send me DMs, and I'm just like, okay, here is what I think. This is A, B, and C, but you probably need to follow up with a real in the flesh doctor, so that you're getting the correct information and the correct diagnosis and the correct treatment. So
for sure. And I know that, like, they always say that, like, our vaginas there's not a lot of work you need to do with our vaginas, because of the way that it's been created and stuff like that. But I'm noticing that a new trend that's starting, actually maybe the last couple of years, is this vaginal steam. Now, I know that they say, stay away from, like, like the Vagisil. Don't do those, because it does mess up your pH balance.
Yeah.
What's the benefit of a vaginal steam?
So I actually did one, because I was also curious, because I was like, let me see what this is about, because everybody keeps asking. So I went and I did one. For me, I used it as a self-care practice. I only did one. So was it enjoyable? Yes, probably, because it was the first time in like months that I was alone and didn't have to answer questions and nobody was bothering me. The thing about it is, it's steam, right? So it's really hot. So you have to be careful. Like, you can get burnt from the steam, because it's very, very hot. So that's one of the caveats that I tell people, like, it's hot, so you can't, like, sit there forever. Like if it hurts, you got to get up. Like you shouldn't
Right.
continue, like, because you will get like burnt from that. But I don't tell people not to do it. I just say like, I personally, I use it as a self-care practice. Do I recommend it? I wouldn't recommend it for, like as from a clinical standpoint, I personally wouldn't recommend it. But if you want to do it as a self-care or you believe it works for you, then that's something you should continue. But it's steam and it's hot. So,
So how
you
long
got
did
to
you
be.
put on there for?
So I think it was, gosh, I want to say it was like either half an hour or 45 minutes. And, they put the blends together for you.
Oh,
But yeah, it was hot. So I had to get up a couple times like this,
that's what
I'm
I'm
not about to,
thinking,
yeah, like I don't want to burn my vagina,
right?
my vulva. So let me get up. Or I had to like readjust. But the fact that I got to sit there by myself and kind of just relax, that part I enjoyed.
Yeah.
So
Did you feel like, I know you said that it wouldn't be something that you would recommend, but if you wanted to try it, you try it. But
mhm.
did you feel any benefits? Like, was there
Different.
anything?
I don't remember feeling, and again, I only did one.
Yeah.
So, some people will say, you have to continue to do them. I didn't feel there was any benefit. I felt relaxed and lighter because I got to sit by myself without my baby bothering me or my
Right.
husband asking me questions. But I only did one. And so I know the argument is like a lot of people will say, like, you have to continue to do them or do them every so often to get the
Right.
benefit.
Okay. All right. All right. Well, it's really interesting because, as I said, like you see now, you're starting to see a lot of different trends now.
Yeah, yeah,
And as you said, like women are starting to become more comfortable talking
right.
about our bodies, our vaginas, because that has always been a taboo, right?
Yeah.
Don't talk about a woman's vagina type of thing, right? So, I mean, to know these things and to be able to, your platform to educate, like it's awesome. Like I read it every time, and as I said, like I get information from it, I'm just like, oh, this is really interesting. Like, wow. And I mean, yes, you're in the States, but as I said, I still feel like it still relates to us regardless of where we are.
Right, right.
Some of your practices are the same as Canadian. So for me,
Yeah,
it's like there's no difference, right? But
yeah,
it's really educational. And I think that as we continue to get older, and even our kids being able to sit down and have a conversation with our kids, like, I mean, obviously you're a nurse, so I'm sure you're gonna be comfortable to be able to talk to your daughter when it comes time for,
the
things like that,
discussion.
right?
It's still a little weird, but because kids, like you said, they will catch you off guard, like when you're not expecting it. So,
Mm.
you know, she's comfortable. Like one of the things I wanted, my husband, he was like, "What are we really doing?" But I wanted her to be comfortable saying the word, like the actual words, like say vagina because that's what it is, say penis
Right.
because that's what it is. So getting her to use the actual names for things, and then just like getting her comfortable and okay with having these questions. My husband, I tell this story all the time, like he was like literally cringing because I think one day I'd given her a bath and she'd asked me about like where the pee came from, like where does the pee come out of?
Right.
And so I was like, okay, you want to know? Let's go. So I got her the mirror and I sat her down and I'm like opening up stuff and I'm like, you see this? And so he walks in the room and he's like, what are you doing? What is really going on here? And so I'm like, she asked a question. I'm like, this is how, you change the dynamics and you change
Yes.
that history. Like you can sit down and you have the conversation and
Yes.
you let her know like this, it's okay. And it's okay to ask me these questions. It's okay to know because, somebody has to teach you and
Right.
it may as well be me type of thing.
For
So
sure.
yeah.
And that's actually a good question before you leave. What would you recommend would be a good time or age to start having those conversations with girl children? Like, for instance, the name calling. I mean, I'm sure there's still people out there that's still not teaching their kids to say vagina because, once again, that's a taboo thing, right? I
Right,
mean, when we were
right.
growing up, it wasn't called a vagina; it was called like a whole bunch of different names,
Right.
peanuts, or some names that people would be like, "What?
What is that?
Cookie?"
Right.
Or you know what I mean?
Yeah.
So, like, what would you like? Obviously, based because you are a nurse and stuff like that. But what would you recommend would be a good time to start talking, or start that narrative?
I always recommend like starting young, like as young as 3 and 4, because kids are curious by nature, right? They ask a million questions in like 2 minutes. So
True.
at some point, these questions are gonna come up. And personally, it's easier when they're younger. Like it may catch you off guard, but it's easier to start when they're young because they're just the questions that they're asking, the answers are usually superficial. So it's okay to like, you don't have to get into like the deep details. They're like, okay, well,
Right.
what is this? And you're like, it's a vagina. That's usually enough to satisfy their curiosity. And then they move on to something else, right?
Right.
But it should be start young, and it should be an ongoing conversation. Like it should like it's not a one-time thing. Like when we were younger, like when our parents just sat us down the one time, it should be an ongoing conversation so that when by the time they get to that age, like where they're going through puberty, they're comfortable coming to you and talking to you. Mind you, I recognize it may not be easy for every single parent. Like,
Right.
what is this? Like, this is not what I want to be doing. But, you can take a moment and say, like, to get your thoughts together, like to table their question and to come back and answer it. I'm always a big advocate for using your resources. So like somebody always has that mom or that friend that was okay having these conversations. Use your pediatricians or your family doctors because that's what we're here for, to have these conversations with your kids about this. But it should be an ongoing conversation building upon like some of the things that you've taught when they were younger.
Completely agree with you on that. And I think that's some of the things that we as moms need to try to work on, right? Is definitely being able to have that conversation. Because as I said, like when we were growing up, I think we were learning from our friends, right? Learning from like the school.
Yeah.
And even that what we were learning from the school wasn't necessarily like good, proper information or
right.
like
or the things you needed to know, right? They'll teach you like the basics, but like the stuff that you need to know, you're like, oh, I didn't learn this nowhere, so let's just figure it out.
Yeah.
Right.
Exactly. I mean, mind you, as I said, I did fail, so maybe I did miss information. I don't know, but hey, I survived it. I'm here. I'm good.
Hey, you're thriving. You got grown kids. They're alive. You alive. You're doing fine.
All that matters, man. All that matters. But no, Janelle, I do want to say thank you so much for joining me on my podcast and having this conversation with me. There's one thing I do have to say. I do feel a little bit better after having this hysterectomy.
Good.
As I said, like I know that there was a little worries I went through, but through some of the stuff that you said, I do feel like for me, I made the right decision. But as you said, like it's going to be different for everybody where they are on their stage. I mean, I don't have to worry about periods anymore.
Yeah. Yes.
But I mean, that's definitely one of the advantages of
right. You are not. I have plenty of friends like that. They're like, I got it. I'm good. I'm so good.
I don't have to plan trips around just go. You know what I mean? Yeah. It's going to be a whole new life for me right now.
Right. And it's improved your quality of life. And essentially that's with every woman, like that's what you're looking for, an improved quality of life. And for you getting a hysterectomy, that did that. So you made the right choice.
Yes, exactly. And so it's going to be different for everyone, but definitely, as I said to my listeners, Janelle is a wealth of information. I just want to say that. Please hit her up on her Instagram, her Facebook, her Twitter. For those who have an iPhone and you can now go on Clubhouse. I have a Samsung, so I still cannot experience the Clubhouse life.
The Clubhouse.
But definitely find her at the Nurse Note, where you can get a lot of information. As she said, she's open to DMs, questions. And even though she's in the States, it's still the same information that we can use for ourselves here in Canada or anywhere else in the world, right?
Right.
And of course, it's about having the conversation with your doctor too.
Yes, of course. Find you a good provider that's, you can have these conversations with, because that's key.
Exactly. So I do want to thank you. Is there any other piece of advice you'd like to leave for us?
So everybody, I tell everyone, everybody's journey is different, and it's going to look and feel different. So, do for your reproductive and sexual health what is best for you and your lifestyle.
Thank you. Thank you. Thank you so much. Thank you, Janelle, for blessing us with your presence today. And I hope you have a good day.
Thank you. Thank you so much for having me. This was so much fun. I enjoyed it.
You're welcome. Hopefully we'll connect again sometime.
Of course.
All right. You take care.
All right.
Okay. Bye.
Bye.